Hello, my name is Emily Kemp, and I will be presenting an independent research project that I completed with Dr. Collinsworth last semester on the topic of the role of social support and domestic violence in trauma and self-disturbance in female prisoners. For some brief background, in the past decade, female prisoner rates have steadily increased, resulting in female incarceration numbers being higher than men's by nearly 2 times. There is a large majority of women who have a long history of past trauma, such as sexual abuse, physical abuse, assault, and domestic violence. This tends to lead women down a path of destructive behavior that eventually ends with a jail sentence. These female prisoners can begin developing PTSD symptoms such as hyperarousal, memory loss and avoidance, intrusive memories or flashbacks, disassociation, insomnia, or paranoia. Post-traumatic stress disorder has become increasingly common among female prisoners, with it affecting 40.2% of the population compared to only 12.5% of male prisoners. This study that was conducted consisted of a survey given to women in a correctional facility to assess whether they exhibited symptoms of PTSD. They were also asked to describe the levels of social support they were receiving and what levels of domestic violence they had experienced. The hypothesis is that both social support and domestic violence will have a significant effect on the trauma and self-disturbance symptoms that these women experience. Having high scores in either trauma or self-disturbance can lead to a diagnosis of PTSD. Consequently, if social support and domestic violence have a significant impact on these results, that could shed light on one source of PTSD that can be maintained to reduce the number of women who lead a path that ends in incarceration. There were 197 participants surveyed from a Midwestern correctional facility. The data collected was scheduled for 3 consecutive days at the prison, and groups of approximately 15 to 20 women were administered the survey. It was administered in a classroom at the correctional facility, which was selected by the faculty, where only the researchers were present in the classroom. The survey was given to the participants that had a total of 249 questions. The first 7 questions regarded background information about the participant. Next were 136 questions taken from the TSI-2, which is a clinical scale that measures responders' trauma-related symptoms under these 4 categories of distress: self-disturbance, post-traumatic stress, externalization, and somatization. The TSI-2 was the primary outcome measure. Lastly, there were 106 questions that covered questions ranging from mental health, alcohol use, drug use, social support, domestic violence, sexual experience, to traumatic life experience. A bivariate correlation was conducted to explore the relationship between trauma and the conflict tactic scale in the TSI-2 survey. The results showed a significant positive correlation between the two that suggests the more domestic violence one has been through, the higher their score will be on the trauma scale. The correlation between trauma and the social support scale from the TSI-2 was also examined, and it showed a significant negative correlation that suggests as social support decreases, trauma increases. The results between self and conflict tactics showed a significant positive connection, which suggests that as someone experiences an increase in domestic violence, there will also be an increase in self-disturbance. And lastly, there was a significant negative correlation that showed that when someone receives less social support, they are more likely to experience higher levels of self-disturbance. Based on the results, there is significant evidence to suggest a strong correlation between the two variables in the PTSD symptoms. Both the amount of social support and domestic violence that these women prisoners received led to higher scores of trauma and self-disturbance. This leads to the idea that other outside variables can negatively impact someone who's experienced trauma, which could contribute to a worsening mental state and a diagnosis of PTSD disorder. Although this is one study, if repeated in other female prison populations, the validity of the results is likely to be similar or the same. The implications the study could have on the female prison population is vast. Since domestic violence has been identified as a contributor to PTSD symptoms, that sheds light on the importance of law enforcement to give more focus on preventing domestic violence rather than imprisoning women at a faster rate. Giving women the support they need through various mental health services could help to decrease the growing number of female prisoners who may be incarcerated due to the negative mental impact PTSD has on their decision making. Since social support also has a significant impact on the severity of PTSD symptoms, this shows that more should be done to provide the necessary social support for females who are currently in prison. Taking both these measures could result in a decline of repeat incarcerations and could give those suffering from PTSD the support they need to alleviate their symptoms. Steps must be taken to decrease the number of women who end up in prison, because this problem remains unsolved, and until action is taken, women's incarceration rates will continue to rise. Thank you.